Now we start with Jones 1 and Jones 2 procedure. First of all, Jones 1 procedure. What happens in Jones 1 is that we put a swab in the inferior meatus and a conjunctival and a strip, fluorescein stain stripped in the conjunctival sac. And after 15 minutes, we see whether this swab that is located in the inferior meatus, is it stained or it is not stained. If it is stained, this means that whole system is patent. This means that there is a no blockage and the test is positive. Now the interpretation of negative Jones test is that there can be a blockage anywhere down this system. So Jones 1 tells us that there is a blockage, but it doesn't tell us where the blockage exists exactly. For that we do a Jones 2 test. In Jones 2 test we do a syringing. We remove the fluorescein stain strip. So there are two possibilities. That first possibility is that the upper canaliculi and the lower canaliculi are patent, and through them the fluorescein has entered the lacrimal sac. So now we do the syringing through the with the normal saline, and we see whether this swab that we have placed in the inferior meatus, whether it is stained or not. So if the fluorescein stained fluid has reached the sac and the lower system is open, this means that Jones 2 test is positive. So the interpretation of positive Jones 2 test is that after the syringing, the swab in the inferior meatus is stained. Okay, so either there is a partial NLDO or there is a lacrimal pump failure. Now let's say even after the syringing, this swab is not stained or it is not wet. So this means that the fluid has either not reached the conjunctival sac, the stained fluid, or there is complete obstruction of the nasolacrimal duct that has prevented the fluid to reach the swab. Okay, so the interpretation of Jones 2 test is negative, is that there is either a complete NLDO or there can be a phlebolith or total obstruction of the lumen of the lower system of the nasolacrimal apparatus. Okay.